Welcome to the 2017 Open Enrollment for Solar Industries. We are happy to provide you with an overview of your benefits and are excited to announce that this year Solar is providing you and your family with new benefits. Today we will cover how the open enrollment period works, provide you with a quick update on what you need to know about healthcare reform, review your coverage options for 2017, and wrap it up by outlining your next steps for you. Let's talk about what open enrollment means. Open enrollment is happening now. This is the only time of year when you can make changes to your benefits without having a qualified event in order to do so. For example, you may want to change from one healthcare plan to another, or you may want to add dependents. Now is the time to do that. Your changes will go into effect on January 1st. Remember, if you do not make changes to your plans during this open enrollment period, you will be unable to make changes until next year's open enrollment unless you experience a qualified event. Outside of the open enrollment period, you may only make changes to your benefits if you experience a qualifying life event. A qualifying life event may be, for example, a spouse that loses a job and needs to be added to your plan. Or if you get married, you can add a spouse to the plan. Just make sure you notify your Human Resources Department within 30 days of the qualified event and bring the appropriate paperwork with you, such as marriage certificate. Now let's take a few moments to review what you need to know about healthcare reform. There are a couple of important facts you need to know about healthcare reform. You are required by law to have health coverage. If you do not maintain health coverage, you will be penalized during tax time. The amount of penalty is based on your individual filing status, dependents, and income. You should know that as an employee of Solar, you are not eligible for a government subsidy through the exchanges. If you want to learn more about insurance plans offered through Marketplace, please visit healthcare.gov. Now let's take a look at your 2017 benefit plans and resources. At Solar Industries, our employees and their families are important to us. We are excited to continue to offer 3 Cigna medical plans for you to choose from. As an added benefit, when you sign up for medical benefits, Solar will automatically sign you up for the basic dental option, vision coverage, and life insurance. Also, if you sign up for Family Medical, you will be enrolled in Family Dental and Family Vision as well. All 3 medical plan options will be available from Cigna. Each plan option includes both in and out-of-network coverage. Preventative care services are covered at 100% under every plan, and you do not need to elect a primary care physician under any option. You may seek services from a specialist at any time under all 3 plans. Remember, you must elect coverage in a medical plan option in order to also have dental, vision, and life insurance benefits. Let's review some of the insurance terminology and explain how your plan works. A deductible is the amount of money you will have to spend out of your own pocket before the insurance company pays their portion. A copay is typically a smaller amount of money you pay up front at the time of a service, such as at a doctor's visit, urgent care, or an emergency room visit. An out-of-pocket maximum includes both deductibles and copays you spend out of pocket and signifies the most amount of money you will have to pay in a calendar year. Once you reach this limit, the insurance pays 100%. In this chart, you will see the outline summary for the base plan. This plan requires that you pay $5,000 deductible out of pocket before your insurance begins to pay their portion, which is 70%. If you simply want to visit a doctor's office, you'll be paying a copay of $30 at the time of service. If you do choose to see a specialist, your copay would be $60. Under the mid-plan option, you'll see that there is a $2,500 deductible for hospital care. Again, if you only seek care at a physician's office, you would only pay your copay. Under this plan, you would pay $25 for a primary care doctor and a $50 copay for a specialist or an urgent care center. As you can see here on the buy-up plan, you'll have the least out-of-pocket cost with only $1,000 deductible for hospital care. You would pay $25 for an office visit and a $50 copay for your specialist visit and urgent care visit. Again, generic drugs are the least costly at a $20 copay. This chart outlines your costs for each of the 3 plans. It's important to choose the right option for you and your family based both on the benefits and the cost out of your paycheck. Remember, you choose a medical package and your covered dependents will also receive the company-paid dental and vision plan as well as an employee life insurance benefit. There are 2 dental options available, the DHMO and the PPO, and only those who reside in New Mexico will not have an option for the DHMO. These plans are only available if you enroll in a medical plan. Here you will see an outline of the DHMO plan. Remember, this is not available in New Mexico and is only available if you've elected a medical plan. Here you will see the optional PPO buy-up. You will pay the difference in cost from the company-provided base package if you choose to do the buy-up. Remember, employees in New Mexico only have this buy-up option available, but they will not be upcharged for the benefit. On this chart, you will see the additional cost of the PPO buy-up for those who've elected to buy up the plan. This will not apply to employees in New Mexico. We are pleased to add a vision program through Davis Vision for 2017. The coverage is provided at no extra cost to you when you elect medical coverage. You may not elect a vision plan without first enrolling in a medical plan. The plan is a PPO and offers both in and out-of-network coverage. You will not need an ID card to get services. Simply tell your provider you have Davis Vision and provide your last name and date of birth. Here you will see an outline of your vision plan summary. Please note you also have these benefits outlined in your benefit guide as a reference. We are pleased to be adding an employee basic life and accidental death insurance plan through Mutual of Omaha. Again, this coverage is provided at no extra cost to employees who have elected medical coverage. The basic life insurance is a $10,000 benefit, which doubles in the case of an accidental death. Please be sure to designate a beneficiary as you complete the enrollment process. Also, please refer to your benefit guide as Mutual of Omaha provides other services such as travel assistance, will preparation, and hearing discount program. Now we will review the next steps in completing the benefit enrollment process. Please refer to your enrollment guide for instructions on accessing the online enrollment portal, Employee Navigator. This is where you will make your enrollment elections for 2017. If you are currently enrolled in one of Solar Industries' medical plans, you and your covered dependents will automatically be enrolled in that medical plan option as well as the default DHMO dental plan, the vision plan, and the employee life plan effective January 1st, 2017. If you would like to enroll for the first time, make changes to your coverage, drop your coverage, or add or drop dependents, you must complete the enrollment process. Please be sure and complete this enrollment process no later than December 24th. If you need assistance, please feel free to contact the carriers directly or your Solar Industries team or your DBP team. Be sure to refer to your enrollment guide for further details on the plans and how to enroll in your benefits for the 2017 plan year. Thank you.